Hello everyone, welcome back. Today it's a class 1 restoration. We're going to be removing an old amalgam presently on tooth number 20. We've already anesthetized, rubber dammed, and we're ready to go. I'm going to use a 330 Midwest, and we're going to go ahead and prep out our amalgam. We basically had some ill-fitting margins and a little fracture in the isthmus area, so straightforward. And what we'll be replacing it with, I have a little water please, is a composite, posterior composite. So straightforward, class 1. And we're going to just discover what's underneath our filling as we remove it. And we'll rinse that out. Good. Great. There's some bioburden there, some staining. So you know that there's some micro leakage occurring down the side where the margin was ill-fitting. You can see that brown area, that's bacteria. A little water again, please. Okay. Well, one of the things with the rubber dam on, you can't really ask your patients to communicate too well because they, water please, can't really communicate. But it's a great barrier. It prevents any of the filings from going down into the food tube, as we always express that. So if you can get the rubber dam on, that's terrific. There are other methods of isolation. Water please. And one is called Isolite. I've yet to try it, but it's not the same as a rubber dam. It's different. It's more of an open system. But soon I'll try it. Well, basically, I'm allowing the previous outline to dictate my borders. And now it looks like on the mesial aspect, there's some more filling material and a different color change there. We'll go more water. Okay. All right, so now we have an opportunity to zoom in. And we're going to continue to clean that up. I'm going to use a number 2 round burr. For the pre-dental students, basically outline and form are all done with 1 or maybe 2 burrs. In our class, we don't really use a round burr because there's no decay that we can see. We might want to try to simulate that one time, just to get a feel for a round burr and designate an area on the typodont. All right, and we'll dry the tooth. Now, there's some little planes or fissures that I'm going to go into to clean out that weren't cleaned out by the previous procedure. I'm going to show you where they are located on the distal aspect. So your mesial is pretty much done. Now the distal. So I'm using a fine diamond. So basically they're V-shaped. Now, while I'm in there, polish the walls. So attention to detail, even for a class 1, you would think, why bother? Well, you could say that about margins for crowns. You can say that about the fit. It's all important. Just because it's a more simpler procedure doesn't mean that you can overlook. So I'm going to measure the depth after I clean it a little more thoroughly. We'll measure the depth. Now notice I'm just drying that off a little bit as I'm doing a little more excavating. And then we'll add a liner. Our patient complained of some cold sensitivity in another area after dentistry was performed, and I'm just wondering, is it root sensitivity on the outside, possibly, or is it internal? Many of the fillings that we place are very insulating. So we wonder, we'll take every precaution to protect his tooth. And this is a good time to introduce Composite, which is a chlorhexidine gluconate loaded in a pre-comp syringe. And because we're going to place a filling, we want to make sure the bacteria is all removed from the dentin and the enamel surface. So we'll rinse that for about 15 seconds. I try to do everything in blocks of 15 seconds. 15 second scrub, 15 second etch, 15 second rinse. It's just a measure of protocol and just being thorough. All right, so we'll just lightly, while we're getting the etch, or actually we're gonna lower the light and just dry this. So we're gonna place something called Vitribond, and that's gonna be our liner. A little bit about a microscope. There are a lot of things that you can definitely pick up with the scope, not only in fillings and restorative, but also in implant work. And one of the implants that I'm going to be looking into is a company called Intralock. They're based out of, right now, Boca Raton, my hometown here. And we'll be filming an upcoming case related to tooth scanning intraorally. We're going to scan our impressions, so that should be coming up on a video soon. Alright, so here's our material now. This is where I'll zoom in. Let's see if we can avoid the walls as I just go right down the middle. There we go. Now once it's in there, I just touch it to get it started and then go in with an explorer. So we use a long explorer. Now you want to move it around a little bit toward the mesial aspect of the tooth. Thinning it down as you do that. And then cure it for 20. And then once that's cured, we'll etch the surface and go right into the next steps. Turn that on. Okay, so now we're going to go ahead and etch the surface. And we got to go at least 15 seconds on the dentin and enamel total etch. Bottom line, what I look for after the 15 seconds, I just want to make sure there are little carbon dioxide bubbles coming from the dentin. Looks like they're penetrating. We're removing the smear layer and getting that dentin ready for our bonding agent. Just had one of our patients in the practice that's gone on to dental hygiene school, and she's very excited about that. Okay, and we'll just suction right on top of that, remove some of the moisture. Perfect. Oh, we're staying with the low light. I've got a nice etched surface, well-protected pulp. And now I'm going to, company says, 3M Corporation says, you got to kind of rub the dentin and get it to go into the tubules. So, and their thing is 20 seconds, I believe. 15, 20 seconds, all you need to do. Then you got to thin it down, especially near margins. So we'll thin it right down. And then we'll light cure that. I'll be adding in increments, but we'll be building up the various walls to this bicuspid. This is a second bicuspid, lower left, second bicuspid, so we've got appears to be a lower second bicuspid. So we'll go ahead and add our flowable to the deepest portion, and those two areas that we cleaned with the fine diamond. The class that I instruct over at Florida Atlantic University is a introduction level class for pre-dental students. So all that means is you get a chance to find out if dentistry is a good fit by going through a 10-week, I'd say pretty accelerated class to get your hands and feet wet. Get a wipe here. All right. Okay, so I'm going to finish the occlusal distal portion, and then I'll pack that mesial because that goes beyond 3-4 millimeters in depth. Okay. We have the condenser. And just lay it on its side. I'm going to create that central groove. And I'm going to also ask for the acorn. All right. So I borrow one of the instruments from the side of the amalgam restoration, and that puts in a very nice smooth groove. White, please. All right. And I will cure that. So we're filming. I mean, we are going at a pace that's a little slower, just so that viewers can see, and if you're a student, you can try to get graphs and understand what's going on. In the class, we have two things going on. We've got hands-on experience during the class itself, both morning and the afternoon, and then we have a Dremel kit that goes home with the students to learn how to prep and keep practicing tooth preparations at home. So you get a video with me and about 8 various methods of preparing a tooth, whether it's for filling or crown. We're working on inlays and onlays next. Condenser. And what a great way to find out if you've got the dexterity to go into this profession. I'm even opening it up to just about anybody really that wants to take the class, just to experience it. Yeah, we want highly motivated students, but explore. But I was thinking about even a hygienist could come in and take the class just to learn dentistry, or a dental assistant. Okay, acorn. Class is offered every semester. I'm going to cure that. And registration is online. So if you go to Florida Atlantic University College of Science, continuing education, you'll see the sign-up page. There's also a sign-up to purchase the Dremel kit as well. So there you have it. I'm going to continue to polish, talk a little bit more about how we polish, how we're going to remove the rubber dam, and then post-operative instructions. You want to always tell your patient what they can do right away, what they can't do. First step is to polish a little bit before we get the dam off. And this is a fluted burr, just a carbide fluted, diamond coated, or excuse me, gold coated. And it's just to remove a little excess. Okay, I'm going to take the clamp holder. Transferring out left. And voila, there's our tooth. Welcome back. Now we're going to check occlusion. Okay. So some various areas to adjust. Because they have a numb tongue, you want to instruct them to put the tip of their tongue to the back roof of their mouth as they close, otherwise they could land on the tip, and that wouldn't be fun. Alright, tongue up again, close, tap tap, open please. And you can see the various high spots. Now you have a choice. You can continue to adjust here. Take a look at the opposing. You got a little bit of a cuss tip that we could afford to just reshape. Give them a little more room on the lower. Better support for the tooth. Tongue up and tap again. And open. And once we see contact on enamel, we're good to lay off. And then go right into hand polishing. Tap again. Class 1. So you've got all the essentials, dovetails, you've got an isthmus area. You're bringing back the more of a Y-shape anatomy toward the distal. Single surface on the chewing surface of back teeth. Paper in again. Tap again, please. Okay. That looks pretty good. So I'm going to go ahead and use a polishing point. Again. Alright. Now this happens to be just a polishing point for a high speed. And we'll run some water with that. Alright, so we wrapped it up. This looks good. A little bit more next time too about how to give a painless injection and some more good stuff. Alright, this is Dr. GERARD CUOMO. Thanks for watching. We'll pick this up again with another tooth. We try to put more fillings out there for students to learn. Take care. Have a great day.